The other exciting development in the field of oncology in general, and specifically with non-small cell lung cancer, has been utilization of liquid biopsy. So essentially, liquid biopsy is utilizing circulating free tumor DNA in the blood to test for alterations, which can then inform treatments. So if we look at the cartoon here, there are different sites of the cancer, and some of the cancer DNA actually may be freely floating in the blood, which we can then draw, and using advanced technologies, we can actually understand the genetic makeup of each person's tumor. And depending on that, it actually may help us to tailor therapy and personalized therapy in these settings. So on the right here, I am showing you the difference between tissue biopsy and liquid biopsy. Now, the caveat is that tissue biopsy is still gold standard and probably more sensitive than liquid biopsy, again, from what we have in terms of the current technology, which may improve, and hopefully it will. But the problems with tissue biopsy is that there is obviously a high degree of invasiveness. It needs to be a procedure that a patient has to undergo. And then the other issue we run into with tissue biopsy is the heterogeneity of the tumor. So, for example, if you see there is a mass in the lung, depending on where you are obtaining the tissue from, either from here or this side, you may actually see difference in the genetic makeup as well as the PD-L1 expression of the cancer, depending on where it is sampled from. However, liquid biopsy eliminates this by really reflecting the highest amount of consistent cancer DNA that can be freely floating. So it sort of eliminates some of the tissue heterogeneity that we see with the biopsy of the tissue. The other improvement that liquid biopsy brings is potentially faster results. So the turnaround time typically for tissue biopsy is longer, about 3 to 4 weeks, I would say, in my personal practice, but usually we say it's about 2 to 6 weeks. However, liquid biopsy testing results usually come back within the first 2 weeks, and really that helps us inform decisions early on and potentially, reduce our time from diagnosis to treatment. And then the other option that liquid biopsy offers is really the fact that you could be, because it's a blood test, you could be doing this serially. Obviously, the biopsy with the tissue is obviously an issue where you couldn't do biopsies serially because of the involving invasiveness, again, invasive nature as well as a procedure. However, liquid biopsy offers us the opportunity to serially measure your blood for the circulating tumor DNA. And with that, we can not only track whether a treatment is working by reduction in the circulating tumor DNA, but also potentially whether the cancer is becoming resistant to a treatment by looking at the genetic alterations that the cancer acquires as we go through the spectrum of treatment.